Lompoc Hospital is a 60-bed facility. We serve every age range from newborns all the way up to older adults and geriatrics. So choosing Hamilton partly was because our neighboring hospitals are also Hamilton customers, and so we have a lot of staff who work here at Lompoc and at neighboring hospitals, and so it's nice to be able to have that fluency from facility to facility when we share so many staff.
Yeah, so here at Lompoc, we had very limited resources and a lot of older models with non-invasive ventilation, which led to some patient issues, and the HAMILTON-C1's kind of flipped it on its head, made it a whole lot better. And that's probably the best thing about this thing, besides the machine, is our rep, Mike. He was very knowledgeable when he taught us about it, and then the after support was insane. He gave me his card. He said, I know you work night shift, so night or morning, if you need me, call me. And at 3 a.m., I had a couple questions. I'd never used this machine before, and on the first ring he answered, walked me through it so I could take care of my patient, and then he said, hey, if you need me to come in and show you in person and help clarify things, I will. And at 3:30 he was here. C1's totally reinvented us, streamlining our workload. With the 3 modes that it can go into, we were able to keep one machine for one patient in the same room. That's reducing the time that we have to leave and getting the patient's therapy quicker. Oh yeah, so let's use a COPD patient as an example. That's somebody that we're always gonna start the lowest level of support and work our way up. And with those patients, you know that they may have to get BiPAP or NIV and maybe eventually ventilator. So with the 3-in-1 modes, we're able to stay by their side, not have to leave and waste time going to grab another machine, then coming back. And whether they need just the high flow or the NIV, or they have to get become on a ventilator, we're able to do everything while keeping our eyes on them.
We're a small hometown roach coach facility, so we don't have a large budget, so we don't get to have lots of machines for everything. So really having an all-in-one has been really helpful. It's something also that I could actually trust to take on a CT run. Have a code stroke, you'll go in there, they'll go from spontaneous, not spontaneous. I could trust that I could do both of them just fine. Obviously, being able to save a couple steps to not switch back and forth saves time. But that advantage to bounce back and forth, I think, saves more of anxiety than time. It does save time, but if I'm extubating someone and they fail, I don't have to go running across the room to get something. I don't have to have a BiPAP on standby. Don't need to have a high flow. Just the fact that I have both of them right there just relieves anxiety for me.